Hello, good morning everyone. I'm Dr. Suresh, consultant psychiatrist. They are prone for the illness due to many reasons because the immunity level among the elderly population could be low, and due to medical comorbidities like diabetes, hypertension, cancer, hypothyroidism, and many other medications which could lower the immunity among the elderly population could also make them prone for COVID illnesses. And also, they may have certain worries like they have been dependent on the families where they live with son, daughter. So, or some patients we have seen they have only the spouse who can look after them. So, it is very, very important, and these are the worries which they have been bothering about. The elderly population live with uncertainty because of late they would have lost their friends, colleagues in this COVID 19 infection. So it is important to help them out to come out of this kind of apprehension. What if he gets infected? So rather than having certain worries related to this infection and the morbidity and the death associated with it, bringing about the positive change in them, having a healthy diet, having a healthy pattern in with respect to sleep, having a good interaction with the family members, promoting them to do routine activities at home within the premises, and having the collective or interactive sessions with them will help them to come out of these kind of difficulties and motivate them to do and lead a healthy life at this point in time. So instead of blaming or ignoring the elderly population, it is a right time and a need of a hour to take care of the elderly population and get them treated at the earliest. Look for the earlier signs and symptoms like fever, sore throat, cough, tiredness, breathing difficulty. These are the warning signs we need to pick up because they would be suffering from other medical problems like diabetes, hypertension, cardiac problems, stroke. So they may not be in a position to express their difficulties, or there may be overlap of these symptoms. So it is the right time to identify and get them for treatment or get an RT-PCR done and give the medicines which are being suggested by the physicians. So you can have an home isolation. So it is important to take care of the elderly at home so they feel very happy and they comfortable in taking and continuing the treatment as well. Some of the things which we need to follow: try not to blame, not to pass critical comments for an elderly who gets affected or who have been staying at home. It is very important to provide an emotional support for mental health being. So build a good rapport. All these days you would not be in having a good interaction with elderly. It's okay. Now at least try to build a good rapport with them so that builds a confidence among this population. They are as equal as children. So it is important to provide a good emotional support and mental support as well as the physical needs as and when necessary. And try to look after their medications, diet, sleep, which is also important for their regular healthy lifestyle. Whenever possible, try to make a video calls if you are staying in a different place. So try to involve them, try to communicate them with one or two calls in a day so that they feel more comfortable that family members are providing so much of support during difficult times. Try doing or encouraging their routine activities within the premises or within the space provided, which is safe environment for them. Provide whatever the information regarding COVID-19 at this point in time rather than having rumors or speculations which may worsen their difficulty and psychologically disturb them. One best thing could be allow them to use the technology, like how to use a mobile for healthy purpose, so that they can listen to a devotional song, they can have some playtime online. So it would give them a space so that they can be more lively rather than being sober and sitting in one corner of the house. So it is difficult for them to lead such a difficult life during this time.